With colorectal cancer rates rising among younger adults, healthcare experts, including doctors at Sanford Health, recommend regular screenings at earlier ages. The old standard was 50 years old for a first colonoscopy, but that's no longer the case.
Because we've seen this increase in the rate of younger people being diagnosed with colorectal cancer, a lot of societies have dialed back to an age of 45, generally speaking, for patients to consider colonoscopy or other colorectal screening. If there's a first-degree relative diagnosed before the age of 60, it's recommended that you consider screening at maybe age 40 or 10 years before the youngest person diagnosed with colorectal cancer, whichever came first.
For Eric Knopik, his first screening didn't come soon enough. The 40-year-old from Mandan, North Dakota, was diagnosed 2 years ago after his body sounded the alarm.
Initially, I was just super tired often. Like, no matter how much sleep I'd get, I'd be tired throughout the day. I want to take multiple naps. And then, all of a sudden, my digestive system changed where bowel movements pretty much didn't exist anymore. And then about a month after that, when I was able to go, I was starting to get signs of blood in my stool. And then I talked to my doctor.
Knopik had a tumor in his colon the size of a tennis ball. He was diagnosed with stage 3B colon cancer.
I had surgery where we removed the section of colon and the tumor. We started chemotherapy, which we did for 6 months. All the scans came back clear, and then back in November 2025, I came back in for another CT, and cancer showed on that again. That was a real shock. It took a good week and a half of I was down, like, pretty depressed about, like, now what?
The cancer had progressed and spread to his lymph nodes, including in his neck and back.
I try to avoid stress and just stay positive and think of I got a little 4-year-old daughter at home that I think about constantly, or got to keep fighting and be there for her.
Knopik now wants other people to know they should get their colonoscopies as early as possible, and that there is no excuse to put one off.
I inform everybody that the colonoscopy is pretty much nothing, where they give you the anesthesia and you're in and out. That part's really simple, but you can't be scared of it, because it's a pretty simple procedure. And I also tell them that if they have any sort of symptom, talk to the doctor right away so they could possibly catch it before it was at a stage where mine was at.
In Bismarck, Jason Anschutz, Sanford Health News.